Hi class. How my presentation works is that I have incorporated several video lectures into this PowerPoint presentation. I will discuss a topic, and then after the video you will have some slides to review that were relevant to what my video discussed. I have both embedded the videos and provided a link if the embedment doesn't work for you. Additionally, at the end, there will be a handful of case studies for you to look at and see what possible ways to implement trauma-informed care into the specific case study's care. My topic for this presentation is utilizing trauma-informed care and treating PTSD with older adults in long-term care facilities. I'm focusing on treatments for PTSD and the lapses in research and care that have been identified. As there is a lack in treatment options available at times, utilizing trauma-informed care is often the best course of action for individualized and culturally competent client care. As I work for a hospice, I took special consideration to address providing trauma-informed care and therapies for PTSD that affect end-of-life patients. There are a limited number of longitudinal studies that investigate the course of PTSD in older adults. It is really challenging to complete long-term studies with a population that is close to end of life. Participants could pass away or become too debilitated due to disease progression to remain active in the studies. Older adults have become increasingly at risk for abuse, theft, neglect, and assault as our populations live longer. People exposed to trauma at a younger age can present with significant post-traumatic symptoms as an older adult. Most research on PTSD in the elderly has been done on war veterans and survivors of the Holocaust, with limited data available to consider other types of trauma. Studies have demonstrated that elderly people with poor coping strategies are more likely to suffer severe psychological distress, including PTSD, after exposure to maltreatment. People who have experienced early in-life trauma are more likely to have compromised health and decreased functioning as they age. These comorbidities can lead to a shortened lifespan. Other factors highly prevalent in the elderly population, such as poor physical health, including chronic pain, cardiac illnesses, and frequent hospitalizations or surgeries, can complicate already existing PTSD. Aging wears down a person's coping abilities and resources, which leaves older adults more vulnerable to the emergence of reactions to their earlier life trauma as an older adult.